Whenever you have a time, we can start. Okay, it's not an issue.
Just starting. The new Wi-Fi is logging in again.
No problem. Yeah. And meanwhile, we can tell them. Okay, we will be starting this meeting very shortly. Okay, just a couple more minutes, and we will have our meeting start soon.
Hello?
Yeah, we can hear you.
Okay, perfect. Today, there you go.
All right. Good evening, everyone. Can you hear me now?
And you can
Yeah.
so sorry about
It's
that.
echoing. It's echoing.
Echoing. Yeah.
Having a little time to set the Wi-Fi up in the Airbnb that we've come to. Welcome everyone. Good evening. We're going to be continuing our lecture series on the medical conditions, and today we're talking about attention deficit hyperactivity disorder. And this is the part 2 of the talk on the management of ADHD. So when we think about managing ADHD, we have to think of it in terms of a chronic condition. And like when people have, say, like they have a cold or a cough, or they have any condition that's going to improve, it's different. But if you have a condition that's going to maybe be lifelong, or at least last through all of childhood, then you call it a chronic condition. So the very first thing is educating the parents about this and letting them know that this is not going to be just a 1 day or a 5-day course or anything like this. It's going to be for a while. And you obviously want to get the parents on your side, especially if you're thinking about maybe using medications, or even if you want to do behavioral management. You have to have this sort of partnership with the family. And then when you discuss it with them about the treatment, you're going to develop a management plan with targeted goals. So depending on what the child is experiencing the most, or if it's an adult, what the adult is experiencing the most, or what he's having the most difficulty with, you're going to specifically target those goals. As I told you before, ADHD doesn't just happen at home. It's in all environments. And if you're dealing with children, you're going to think about what's happening at school. So sometimes when we do management plans, we're including the teachers and trying to get their input on it, and also input on how we can manage the behaviors at the school. And then we obviously have a plan for ongoing monitoring with regular follow-ups, and also thinking about all the changes that are going to happen as the child becomes an adolescent and then eventually becomes an adult. So what does the treatment compromise? What does the treatment compose of in ADHD? So I've put medication as the top in the treatment because the AAP guidelines, the American Academy of Pediatric Guidelines for treating most children over the age of 5, they do still suggest that medication is the first line management option. And in medication, we have both stimulant and non-stimulant. And I'll talk about that a little bit later. We also have behavioral therapy. And under behavioral therapy, there's cognitive behavioral therapy, parent management training, social skills training, yoga, and meditation. So I'm not going to touch too much on the specific explanation of what each of those treatments are, but I can quickly just run through it. Cognitive behavioral therapy is the main behavioral therapy. Whenever you're talking about doing a behavioral therapy for any condition, usually if the child is over 5 or 6 years of age, you can do what is called cognitive behavioral therapy. And that's a therapy where you're sort of sitting in front of a counselor, or you're in the room with a counselor, a behavioral counselor, and then they're talking to you and you're figuring out how we're going to manage these behaviors. And the counselor is going to give tips to the child on how they can better behave, or how they can better manage their homework or their plans and things like that. So it's a one-on-one behavioral management program with a child or an adult. And it's the most common in adulthood for sure. When the child is younger, or they're not able to really, they're not able to have a conversation back and forth or understand this, then we're going to do parent management training. So what that involves is the same behavioral therapist will be there in the room with the child, but they will be mostly training the parent on how to manage any behaviors that the child is experiencing. And these behaviors that can happen in the office of the behavioral therapist. So the parent, the behavioral therapist will let the parent know, okay, so for this thing, this is what you should do, and this is what might help better, or what you could do, and what might help better in managing the behavior that the child is having. Many times we have these double glazed rooms where the parent and the child is in one room, and then a double window room, and on the other side the behavioral therapist is sitting, and they can observe without them being in the room what is going on with the parent and the child in particular situations, and they'll make up all these scenarios, and through a microphone, the headphone that goes into the mother's ear, they can explain to the mother, okay, do this, okay, do that, or okay, don't do this. So that's how you manage these behaviors in children. Social skills training is specifically for more adolescents going into adulthood. Even younger children can do that too. And it's basically teaching them social skills. And social skills are skills that you need when you're coming in contact with other children or other people. Just how you interact with them, how you allow for a back and forth conversation to happen, how you don't interrupt and be very impulsive, how you make sure that you pay attention and focus and you're not getting distracted and going off somewhere else, and things like that. How you can play together without getting into fights in younger children. That all comes under social skills training. And then lastly, we all know what this is, yoga and meditation. I don't really have to talk about that very much to all of you because that's exactly what this course is teaching us. And then educational support is really just providing the support in the school. And we have specific plans that the school has specific plans that the teachers put into place at the school. And we will send us prescription with the parents to say that we need to get a 504 plan for ADHD. That's a specific plan that gives accommodations for ADHD, or an IEP, which is an Individualized Education Plan, which the child gets with more support. And it's usually when they have other comorbid conditions like ADHD plus learning disability, or ADHD plus anxiety, or any other conditions for that matter. Okay, so that's about the behavioral therapy and educational support. So let's talk a little bit about stimulant medications. So there's two categories of medications, remember? Stimulants and non-stimulants. So stimulant medications come into two main groups. They're the methylphenidate and the dextroamphetamines. So they might be familiar names to some of you. Methylphenidates are things like Ritalin and Concerta. Most people have heard about those names. Dextroamphetamines are like Adderall and Vyvanse. And what these medications do is that they block the reuptake of dopamine and noradrenaline so that there's more of both those neurochemicals in the synaptic cleft. What the synaptic cleft is, it's the little area between the two nerves that are transmitting impulses to do any action. So when there's more of these neurochemicals, those actions happen quicker and are more effective. And in ADHD, what they have found is that the biggest problem in children that have ADHD or adults is that they lack these chemicals in their brain, mostly in the frontal lobe, as I told you yesterday, which is where all your executive functioning and everything happens. And this medication helps to do that. Now, the beauty of these medications, although they do have side effects, they work right away and they're instant. Actually, the time you take it, within half an hour, 20 minutes to half an hour, you're already feeling the effects. So they have a tremendous, if it works in the child, the parents will say it's like a night and day difference. The child is now concentrating, he's not running around like crazy, he's sitting in a place and he can do his work, he can do his homework, he listens. All of those behaviors that were there before have much diminished. And obviously, sometimes when the kids are having a lot of problems at school or at home, doing just behavioral therapy as the initial approach takes time. It will take at least, I would say, 2 to 6 weeks to start seeing the same kind of improvement with behavioral therapy, maybe even longer, maybe months. So when you're having significant difficulties, we often have to first go to medications, and sometimes we have to go to medications to help the child to listen in behavioral therapy, or to even be responsive to behavioral therapy, because sometimes they have so many problems that it's even hard to get them to the stage where you can even do behavioral therapy. So always, whenever you're prescribing medications, it's always going to be with behavioral therapy. Both of them together are what is supposed to do the best benefit for ADHD. And it doesn't matter which of those we're using, the methylphenidates or the dextroamphetamines, because they both work almost the same as each other. If one is giving too many side effects in a child, we'll switch to the other one and things like that. And the side effects mostly are of decrease in appetite, which is one significant problem in children because you don't want them losing weight. And then there are others as well. With sometimes you can get an increase in blood pressure. It sometimes affects your sleep at night, and it can sometimes give you some odd movements. So it's not a drug to take lightly. Sometimes I remember people used to say that we should all be getting Ritalin and should just be in the tap water, because seriously, everybody would benefit from Ritalin in their day-to-day life. But obviously, it's not without side effects. So if we're using it, we want to use it with caution. And they are controlled drugs because of that stimulant side of them. And they can be abused, just like any other stimulant medication. But when we talk about them being abused, it's if they're taken in the wrong way. If they're taken by mouth and taken at the right dose, nobody is going to become addicted to the medication. So we never have to worry about that. The parent never has to worry about that. But some parents are very worried, and sometimes there are reasons why we can't use the stimulant medications, particularly like if a child has had cardiac surgery done, has congenital heart defects, and has cardiac surgery. Then you want to be very careful in using stimulant medications because they can have an effect on the heart in those patients. It doesn't affect the heart in the normal population, but if there's been some damage to the heart, then sometimes it can, and it can increase the blood pressure. So we're using it with care, and in fact, we try to avoid it in children who have high blood pressure or have any cardiac surgeries, and any children who are very thin and are losing weight. Then we obviously, if this medication is causing them to lose weight, then we don't continue the medication, because it's very important that this doesn't, medication doesn't take over the health of the child. And that's the first and foremost. The child has to be growing and be healthy. So if those are the problems, then, and also a child that's very anxious, we sometimes go to the non-stimulants. So the non-stimulants are also of two main groups. One is the alpha-2 agonists, and those are like clonidine and guanfacine. And they work by increasing, again, noradrenaline in the prefrontal cortex, which is that frontal lobe of the brain, by stimulating the alpha-2 receptors. And these are the ones, what is that the noradrenaline is working on in helping to make the connections and send the messages. The second group are the selective noradrenaline reuptake inhibitors. So those are things like Strattera or Quelby. And these inhibit the reuptake of noradrenaline. Similarly to the other one, they allow more of the noradrenaline to be in the system so that it can be taken up by the nerve endings. Now, both the noradrenaline, dopamine, all of these are neurochemicals that are in the brain. And they are the ones that are causing helping messages to be transferred across the neurons. So it's very important to have those neurochemicals in the brain. And the non-stimulants have less side effects. The biggest side effect of the clonidine and the guanfacine and also Strattera is drowsiness. So we will only use it at night, mostly use it at night. And the clonidine can sometimes lower the blood pressure. In fact, some people may have heard of it as a blood pressure medicine, may have been using it as a blood pressure medicine. But in children, we have very little problem with that, although there have been cases where I've prescribed it and the child ended up in the emergency room because they became so faint or they became so low blood pressure and almost fainted. So that does sometimes become a problem. But they are good medications to use in children that have other issues. They don't work right away like the stimulants, and they actually take about 2 to 6 weeks to start having their effect. But when you give the medication, you only have to, it builds up in the system. So once it's in the system, it's good for the whole day. And you just have to replenish it every day, or sometimes you use it twice a day. But with the stimulants, they will go in the blood and then they slowly get down. They go in the blood and they slowly get down. So when you give the medication in the morning, by the evening, there's no medication in the system. So sometimes we have a lot of complaints from parents who are, or parents who have children on stimulants, because they get them in the evening at home, right? At school, they're doing very well on the medication. The medication is wearing off by the time they pick them up from school, and the child is having actually a rebound effect, being off the medication and getting very hyperactive. So that sometimes becomes a problem, and then you have to give them additional support in the afternoon, evening. So that's what I'm going to talk about medications. If you guys have any questions about medications, we can ask them at the end. So going on to behavioral management. So always when we're going to do behavioral management, it has to be developmentally appropriate. And that means appropriate for the age of the child. And doesn't mean the chronological age of the child, because sometimes we have children who are delayed in their development. So sometimes we can have a 8-year-old who's actually behaving like a 4-year-old. And that's developmental delays. And then when you're giving them treatment by behavioral management, obviously you're not going to treat them like an 8-year-old, you're going to treat them like a 4-year-old. And when you're going to give them their instructions and things, that's how you would be doing the treatment. So as I had mentioned earlier, they're going to be the behavioral parent management training, or is going to be classroom management, which is what we do in the school, or it's going to be involving the peers, and also the organizational skills training for older children. So this is more about like when they get into school. But if we're talking about preschool age children, like between 4 and 6 years of age, the actually American Academy of Pediatrics recommends that the first line is behavioral intervention. So we do always start with behavioral intervention when the child is younger. But as I said before, sometimes if you have a child that is very hyperactive, I do sometimes then have to use medication first if the behavioral intervention is not, if the behavioral therapist says they're not even able to do behavioral intervention for this child. Just as I've said in there. And if the response is not enough, then you might need both of them. So the combination of both is a must if using medication. So you can use behavioral intervention by itself, and that's not a problem, but you really never want to use medication just by itself. And you have to stress this a lot all the time, because once you get this wonderful effect on the medication, parents just sort of drop the behavioral therapy because they feel this medication is so wonderful, we don't have to do behavioral therapy anymore. But the medication is only a temporary effect. And what we want to do is we want to change the behaviors of the child so that they don't have to be on medication for the rest of their life. So that's really important to stress. In elementary and middle school age children between 6 and 12 years of age, as I said before, the first line therapy is medication management because it works so well. And then you add the behavioral support and educational interventions. So we have a lot of things in the classroom that can help the child. They sit near the front of the classroom, away from distractions like windows and doors. You'll try to tell the teacher, make sure that they're always giving them a little bit more attention without the rest of the class knowing, but making sure that they're paying attention to what the teacher's saying and are writing their notes properly, and things like that. And then you have ongoing parent training. You're continuing to help the parent in how you manage the child at home. And when I mentioned earlier, the Individualized Educational Plan, or the 504 plan, is how we get the school to provide instructions in the classroom. And it's really the teacher herself who's providing it. Sometimes we have additional aids that will help in the classroom for children that need it, that additional support. Most of these children are in regular education. We don't have to put them into special education, only if they have other conditions that sometimes have ADHD accompanying them. They're like autism or significant delays in their development. Then they would have to be in a specialized educational classroom and getting the support there. So there have been a lot of studies that have been done on long-term effects of being on medication. So what's the outcome? If you have a child that's in school and they doesn't have medication, or a child in school we do give them medication. I know this study is a little bit old, 2008, but its most recent studies have also shown similar things. They have shown that there's improved reading scores, they have decreased absences from school, and they are almost 2 times less likely to be retained in a grade. So that makes a huge difference for a child in their education when they're in school. And this is when they've been put on medication. And this is what has been shown. So sometimes parents are, obviously, when it comes to adolescence years, the parents often worry about the child abusing the medication, because that's usually when children may start exploring different drugs and things. And unfortunately, that does happen. And so we have to always tell parents that obviously the medication is better to take the medication, because then the child has less impulsive behaviors and are less likely to start abusing other medication. And also are much safer when they're driving, which they do at 17 years of age. So whenever we're giving medications, though, we have to always get the adolescent's assent or consent, because it's not like the parent can force the medication down the child's throat. At this stage, the adolescent teenager has to be ready to also take the medication on a daily basis. And then the educational and behavior interventions are much the same in supporting this child in their middle school and high school years. We are always very careful that the child is not being singled out in the classes, even when they're younger, because they don't want everyone to know that they have a problem. Although there are many kids in the class that have ADHD and they're all talking about it, so it's not like it's something nobody knows about. But definitely, when the teacher's giving any additional support, they usually have extra time when they're doing exams, on tests. They are allowed to be in a quieter place. And there are all different kinds of supports that you can get. And this is really important for a child in high school going on to college, because these educational plans can go on into college as well. And the success is so good when they have a support going on, that they can end up going to whichever career they want to. And if you're not giving this support and the child is falling behind in education, they start losing their self-esteem. They start thinking, like I said before in yesterday's lecture, that they're not clever and that they're stupid. And then it becomes a cycle. Then they won't work hard, they'll become lazy, and then you've lost the child. So picking it up early, getting treatment on board right away, and giving them all the support they need gets them through school and become a very productive adult in society. And when we are talking about adults, some of them, as I said, thirds continue to have the condition, and a lot of them often need medications ongoing. From my experience in all the years that I practice, usually when we're starting medication in a child at, say, 6 years or above, a lot of the time we've had to continue medications all through middle school and into elementary. We always have them have like a break in the summer to see how are they doing, and has behavioral therapy worked, and are they able to try and come off the medication. But many times they've had such a good effect with the medication, with no significant side effects, that they do continue using the medication. It has been wonderful when we've been able to not use medication and just use some behavioral interventions, and the behavioral interventions are working really well, and they actually help change this lifestyle of the child into adulthood, and then they're not needing to use the medication. And sometimes they use it as an as needed basis. So say they're having a test at college, then, or whatever, an exam, that's the time they use the medication. At the other times, they are doing just fine without it. And the same with adults. If they have an interview that they've got to do, or a big project that they're planning, which they need a little bit more focus and attention, then they can take the medication. And that would be the stimulants, because they can be used for one day and then they can be stopped the next day. They don't have to, and it makes no difference to them. So counseling is very important, even in the adults, to provide them support for jobs, in their married life, in their family life, and how they're interacting with the children, in the social environment that they're living in, and with the executive functioning, which I talked to you about yesterday. Now, I'm just touching a little bit on complex ADHD. We call it complex ADHD when it's ADHD combined with any other of the comorbid conditions that I spoke to you about yesterday. So that's things like anxiety, depression, oppositional defiant disorder, tic disorder, and those kinds of things. Learning disabilities. In those cases, they have moderate to severe impairment across the settings. Whenever there are two conditions together, it's going to affect them more, obviously, in all of the areas: academics, family functioning, peer relationships, and extracurricular activities. And we're often having to manage the comorbid condition as well as the ADHD. And many of these conditions, especially oppositional defiant disorder, which is the one that happens the most in about 40 to 50% of the children have this, that is only managed with behavioral management therapy. So if you have a child with that condition, with the ADHD, behavioral management therapy is a must. Otherwise, the medications are not going to look like they have any effect, because they're continuing to show these other behaviors, and then the parents are not happy with what the progress is. And then if they have anxiety and depression, we're going to have a whole talk on anxiety and depression as separate talks after next week and the week after. And Dr. Naina Mehta is going to be doing those, and she's going to tell you all about how you treat those, but they often need medication management as well. So then you're having to balance how much medication to have a child on. So it's much more difficult to handle the complex ADHD. But if we look at all the evidence that has been provided, behavioral and educational interventions are still the foundation of the treatment. Because if you don't provide that, then as much medication you give, these children are still going to continue to have problems. And the main areas that we're going to be addressing for them in management is behavioral, educational, and social. At the home, in the school, and when they're with other peers. And when we do that, we have seen very improved long-term outcomes. And it's always such a pleasure to see children. I see them in my office when I was working, diagnosing them at the age of 6, and seeing them all through 18 years of age, and seeing how well that they progress and how well that they have been managed. So just a final touch on the management. Combined intervention with medication management in these complex cases often indicated, and we are focusing on functional impairment, not just the symptom reduction. So that's really important, because whenever we're making a diagnosis of this condition, the behaviors are one thing, but they are only significant if they're causing a problem in the child's functioning. If the child is still functioning well, then we're not going to be talking about starting medication or anything because the child is functioning well. But if they are having problems with their functioning, then we are going to be using these behavioral managements or medication management. And for significant comorbidities, treatment based on the symptoms that are most impacting functioning is the most important. So if we're having a child who is very anxious and very depressed or depressed, has ADHD as well, we're going to first treat the anxiety and depression, because anxiety in itself can cause symptoms that look like ADHD. And if we treat that, then we're often not even having to manage the symptoms of ADHD. So the one that's impacting the functioning the most is what you're going to attend to first. And finally, talking about mind-body therapy, which is what we all really want to talk about in this course, because that's what we're doing the course for. We're talking about mindfulness, meditation, deep breathing, yoga, relaxation, and biofeedback mechanisms. And all therapists often are using these therapies in regular behavioral management. They might be using biofeedback techniques. They often are using relaxation, because these children need that a lot, because they're so hyperactive. And as somebody just said yesterday, deep breathing is probably the number one treatment option for these children, because that will immediately calm them down. So we have seen that yoga and ADHD, and that yoga is used as a broad term, but I'm talking about yoga with pranayama and meditation. It has shown improvements in symptoms on the symptoms and on the rating scales. It's helped to reduce medication dosage, and the children themselves report less anxiety, more ability to focus at school, and they have less conflicts with their peers. They have increased time on task in class, so they're able to do that better, and improvement in executive functioning. So it does really help, and studies have been done to show that. And what the effect on the brain is from meditation has been shown also by studies, is that it increases connectivity amongst the brain regions. And that's what helps with executive functioning. And it's all happening in this frontal lobe area. And we have seen measurable changes within the brainwave activity, with significant increase in alpha and theta wave activities, which is what we want to see in these children to make them more attentive and focused. And it has also shown increased dopamine release, which is the main neurochemical that is needed in controlling these impulses that the kids have, or the lack of attention that they have. And then what do the children see themselves, or the subjects see? A reduction of self-reported ADHD symptoms, improved performance on attention tasks and cognitive tests. And this is, I'm talking about in the studies that have been done, and improves attention and executive functioning. So all of those things have been reported to have improved with meditation. And the advantages of yoga and meditation are, unlike medication, there are no harmful side effects. There's no cost compared to clinical therapy, and it can be done anywhere and at any time. So it's a wonderful treatment to learn for all of these children or adults with ADHD. Oh, I don't know why it went like this, but in conclusion, a parent who learns mindfulness through yoga or meditation may have improved methods of disciplining and responding to a child's behavior. And in turn, the child may learn from the parent how to change their behavior in a positive way. And so that's really telling you that when we're doing meditation or yoga in the child, the parent's actually the one that we are also teaching to become more mindful with this, so that they can parent the child better, who and then will learn from the parent. And that's really what we want to do. Thank you for your attention. And if you have any questions, please go ahead. Stop sharing.
Red.
All right, there we go. Yeah. Okay.
Thank you for the talk. I have just one question. So, uh, ADHD is mostly in the discussion related to behavior and academics for a child, but complex cases could affect their extracurricular activity and all. So, how about like child's performance for sports or other activities if they have ADHD?
That's a very good question, Anita. So actually, ADHD does also affect a child in these extracurricular activities, even if it's not the comorbid conditions, just pure and simple ADHD, because it's going to affect them in sports because of their lack of attention and focus and the hyperactivity. And we often have children needing to have, if say they're on medication and it's wearing off, then they might need to have medication for these activities. And if behavioral management therapy is being used, then obviously that has to be incorporated into that too. But obviously you cannot do behavioral management therapy on a soccer field or in any other activity as easily as you can do it managing them in schools. So sometimes in those cases, medication is used. I have to say that the great thinkers all had ADHD because realistically speaking, even though we see the bad effects of it, these kids are super smart and often think outside the box. And and sometimes they can be the best soccer players as well, because with their extra activity, they can actually sometimes do better. So we have to be very careful when we're talking about trying to make them all boxed in a very straightforward manner. All kids have to be behaving exactly the same way. No, you want to keep them also having their own personality and using some of the skills to think outside the box or to excel. But when they're impaired in functioning and they're not doing well, that's when we're addressing the issues. If their child is doing well and may have a little bit of these behaviors, you can sometimes just let them be.
Yeah, there's very fine line between what
very fine line in making the diagnosis, right? Because they can go, if a parent wants to diagnose of ADHD in the child, they will shop doctors. They can do shopping until one doctor is eventually going to give them the diagnosis, because it's not a blood test or an MRI scan or an X-ray that's going to show the diagnosis. It's what the physician thinks. And if they see enough physicians, one of the physicians is eventually going to say, yes, okay, you have ADHD, let us treat. And unfortunately, these conditions are like that it's a lot and a lot of it is coming from what the parents telling us, right? Sometimes this can be behaving very well in my office, and the parents giving me this whole history of how bad the behaviors are at home. But then if I get the same report from school, then I will make the diagnosis, even if they are behaving well in the office. So we are relying a lot on what other people are thinking about the child.
Got it. Thank you.
You're welcome. Any other questions?
Yes, I have a question for Naina.
Sure.
Till what age ADHD is there in people? Does it reduce with age? Children, of course, it's obvious. It's more obvious in children because they are not inhibiting, they're not hiding it or anything. But as children become more mature, so does ADHD stay is it a lifelong condition, And how long should it be taking the medication?
Okay, so for the first question, ADHD can be considered as a lifelong condition in some people. It's not necessarily a lifelong condition. So, in fact, when they do the studies, a third of the children or people diagnosed in childhood will not have ADHD as adults, or have the symptoms of ADHD or need treatment. And it's a little bit maybe like asthma or something. So as their brain is maturing, the neurochemicals are forming more efficiently and the transmissions are occurring more efficiently, and they've outgrown the ADHD. In a third of the population, they continue it. But as I was saying yesterday, the hyperactivity and impulsivity gets less and less, and then just the inattention is there. So then you're not seeing the person sitting next to you in your class could have ADHD inattentive, but you wasn't looking at them because it's not a condition that you see from outside. It's what the person is feeling from inside. So they, as adults, can still have that inattention part of it. And if they have the other comorbid conditions, then obviously they are having more problems later on in life or even into adulthood. Many times the treatment as when you start in childhood, they're not always needing it into adulthood, but sometimes they do.
I see. So do the medications taken in childhood delay that process of maturing?
No, it's not delaying the process of maturing. It's actually because it's what the medication we're giving is only replenishing what's not there. So if it's not like you're giving the medication so the brain is not saying, okay, now I'm getting so much medication, I don't need to produce this. It's not like that. It's not like it's that kind of thing. It's actually their absence is there, or whatever is there, they're working to help to use it better, or preventing it from being reuptaken so that there's more in the system. It's only providing extra. It's not making it's not going to have a negative feedback. Yeah, it's not like with thyroid medicine or something where if you give too much of it, it's going to stop the hormone coming down. It's not that way. It's not hormonal that way at all.
Okay. And what does it do to the medication do to normal children? Because there is a temptation, like you mentioned abuse.
Yes.
There is a temptation by normal children to start taking it.
Yes, 100%.
Academic activity and performance.
It helps. It helps to improve your attention, and your performance goes up a lot. So many times you have, that's why it's a controlled drug, the stimulant I'm talking about, because the children at school or in high school are often giving medication to their friends, or the friends are asking for it, not giving it. The friends are asking for it. If they can have, so it has to be very well prescribed, and obviously the parent has to oversee it into adolescence. But then when you become an adult, I know for sure, and I know from history and from seeing like the med students that rotate through our clinics or residents, they talk about that a lot, that they will go to doctors to get the medication to do better in their exams. And obviously they'll give the symptoms of they're not paying attention and focusing on things like this and having struggles, and then they do better. Yeah. But then all the side effects do happen, but then they're not using it all the time. They'll just use it for that time period of the exam to help them to study better.
Yeah, I can understand.
It's like caffeine.
Yeah.
It's caffeine on steroids.
There is a dependency problem too, right? Once they start taking it.
So no. So this medication
mentally, not physiologically.
Oh yeah. So no. Then after that, when you see what one of it does, then you want to keep taking it, right?
Yeah.
It's not like a dependency for the illicit drugs. But it is like that. But if they abuse it in any way, like, because sometimes you can open a capsule and you can take the medication by your nose and things like that, then it's definitely you'll start having the abusive potential. But I think that they can sometimes get dependent on thinking they need it, that they can't study without it. So yeah, that can definitely be a problem.
I missed,
Yeah, good point.
thank you. I missed yesterday's lecture
Okay, no worries.
session, but in your talk, it came up anxiety and depression is separate from ADHD.
It's a separate condition from ADHD, but you see it very commonly in children with ADHD. So if you have ADHD, the likelihood of getting anxiety or depression is about 25% to 30%. And you have to make sure which one is more prominent in the child. Like sometimes what happens is that when they have ADHD, it can actually start making them feel more anxious, or sometimes make them feel depressed when things aren't going well. So you can also get those symptoms of anxiety and depression, and it doesn't always have to be like a diagnosis. And we would be providing some behavioral management therapy for it. Sometimes you have those diagnoses already inherently. Sometimes it's genetic. The parents have a lot of anxiety and depression. Then you might see a child with anxiety and depression, or even if the parents don't. And that child with anxiety and depression can also have problems with ADHD. So it only becomes a diagnosis when the symptoms are excessive of what you would think would just be with anxiety. Because if you have anxiety and you're not paying attention, then obviously when you treat the anxiety, the attention symptoms go away. But yes, but they commonly seen together.
Okay. Okay. Thank you.
Yeah. It's a lot for the poor children to deal with.
Yes. And the parents.
And actually a lot more for the parents. That's true. Yeah. But the treatment is there.
Yeah.
It's not a not treatable condition. So that's the good thing. With treatment, they do really well.
Right.
As long as they are, I think we lose the kids often in adolescence, and as they go on into college, lose in the sense that sometimes they just drop taking the medication because they just, even in high school, they don't want to take the medication, and then they start doing poorly, and then they don't achieve as well as they could have achieved. Their grades are not good, they don't get into college, and then it just becomes that vicious cycle, right? It's like school dropouts, which is a real shame, because it's a condition that could have been treated. But it's got to be by the adolescent's consent, because they don't take medication. There's nothing the parent can do.
That's right.
All right. Anyone else? Any questions?
Okay, then is it connecting to the malnutrition or food available for the children's in ADHD?
Is it connected to sorry, what do you say, the food?
Food or malnutrition, like proteins or anything.
Malnourishment. Okay. So children that are malnourished, if they are severely malnourished, like if you were really starving or things like that, even then I don't know that it's ADHD becomes a problem. But if they haven't had good parenting at the beginning, like they've been children who are going through many like foster homes or adoptions, or they've been deprived, they're like in what are they called, they haven't had a good social surroundings in early childhood, deprivation, then they have seen ADHD problems. And then in food wise, the foods don't cause ADHD. They've done lots of studies, even the additives, the dyes, the sugars. People always think that that's been the cause for the increase in ADHD, but there hasn't been any proper study that has shown that that's, to my knowledge, that is real. It sometimes can make ADHD children worse, like if they have ADHD and then they give them a lot of sugar or dyes or something, then they can become more hyperactive.
Okay.
But it's not something that you tell the parents that, oh, they cannot have this or they cannot have this, because they hasn't been shown to be causing it.
Mhm. Okay. Thank you.
Okay, yeah. Okay, I don't know if Samniji is here.
Yes, so thank you very much.
Samniji.
Yes, thank you for
Nice
discussing
presentation.
about the diagnosis and also the management of ADHD. And you are true that environment is mostly responsible for creating such kind of problem in the child. If they are not being properly taken care of by their parents, or they are not getting proper environment, then this kind of problems occur.
Right. So that's when it's very severe environmental deprivation, Samniji.
Correct.
When they say just normal parenting, they don't say that causes ADHD. Like if you have bad parenting, the child doesn't always get ADHD. If the child has the problem of ADHD and then they have bad parenting, then obviously we're going to see the symptoms more severely, because there is some problem that the children have in their brain as well, of having less of the neurochemicals or less of the transmissions occurring in their prefrontal cortex, which is what has been shown in ADHD. So it's definitely a neurological condition, not just a behavioral condition. But a lot of the time, the behaviors, how they're managed, it can sometimes look worse. Because we even went to India and did the study on a rural village in India. And I had the Vanderbilts translated into Hindi, and I gave them out to the parents and the teachers in the school. And we studied this, I don't remember how many, I think 80 plus children in one school. And the incidence was the same. We found the same number of kids had ADHD as I saw in America. But they're not picked up in by the schools. The children in those schools, because there's like 50, 60 plus kids in the class, the kids are just thought that they're like badly behaved kids, or they're not very smart kids, and they just fall through the cracks, and then they get into trouble all the time. And then I think eventually they probably don't even like school. But they actually have that condition. I mean, you can't prove it because we don't do brain tests and everything, but from the questionnaires, and then we actually did this yoga meditation program there, and we saw improvement. We saw improvement after 6 weeks, we saw improvement after 6 months, and then even after 2 years, we went back. And this is just one school that we did this in, and but it could be replicated in many schools.
Yes. In India, mostly parents or the teachers, they think that he is naughty, so they don't care of, and they don't think that why this problem is with him, and they don't treat the cause. Just they declare that he is naughty, he is undisciplined.
And they have severe discipline, right? They can spank them, they can do all sorts of things in India still. I mean, I don't know now whether it is, but I feel like that happens there more. Here, obviously, the teachers are not allowed to do anything to the children. Like, you can't even like raise your hand or nothing. So they have a harder time managing children with ADHD than they would in India, where they are much more disciplined in school.
Yeah, there is discipline, and also the parents can also raise the hands. So the child somehow will learn to be in discipline. He is bound to be in discipline. He is bound to be disciplined, though the real cause is not treated. But they are bound to accept the punishment by the teachers, by the parents.
Right. Exactly, because they
there is social fear also. that he will be taken in that sense, so he will not get good
Yeah.
company or other things.
Yes, correct. That's
So
good.
sometimes the social fear and the parental fear is also very good for the child to be disciplined. Otherwise, they will do what here people are doing. They are taking gun and shooting so many people.
Yes, they're taking advantage. I
So
think
that is also found here in the US, and you cannot find such things in India.
correct. It's not there. And I think that the whole thing of respect is much more in India than here. Respect for your
Yes.
teacher, respect for your parents. So
From very childhood, it is taught that you have
childhood
to
it's taught.
respect, you have to bow to your elders, respect them.
Yes, yeah.
Don't say anything against them like this. So they are taught like this
Correct.
in their by their parents and also by from in school.
Yeah. That is very true.
Because the families are going on like this, so automatically all the families are following those values. The teachers will also teach the same thing.
Yes. So yes, I think we saw that the incidence was the same as here, but I think overall it's probably not picked up as much, and it's not diagnosed the same way as it is here. To that degree, maybe in the cities now it's a lot more common, but I'm sure not in. And the other thing is also that we need the children to function in a certain way in the classrooms settings here and things like that. Like if the child, I tell the principal, if the child was allowed to just be running around outside, like in the olden days where they would just be in, they could be in the fields or whatever, and there's not like the four walls of a classroom, then ADHD wouldn't even be diagnosed, right? Because there's no need for the child to be attentive or sitting still for this certain long periods of time. So I think it's just how we have moved in society that we need the children to all behave in a certain way so that they can be successful in school.
Yeah, it is all the family environment actually, which has to teach all these values from very childhood.
I mean, I really love yesterday somebody just about
Because
science
there
of
are
living
so many
class.
legal rules and liability issues for the school teachers, so they cannot do that. But at least the parents should take care of all these things.
Correct. Yes.
It is good for them also in the old age, or when they need the help of the children, they are always away and engaged in their own life.
Yes, oh no, definitely. I think there's so many advantages of how children are raised with those values in India compared to the culture here. And there are positives of the culture here as well, but definitely those values, that value system is very special, very special.
Yes.
And all of that adds to the condition, right? All of that adds to the behaviors of a child. So it's true. Many times this is what you'll see, that the behaviors are dampened. They're not so physically becoming a problem to the child at school or at home because of the way the parenting is.
School education has become so secular that they have overlooked the higher and good values of life. Just how you can earn money more and more, how you can be more and more professional in your job and can be rich overnight. This is only the purpose of the present education.
That's true. I mean, there's so many
But money has become everything for them.
Yes. Talking, I mean, they say that, in school that there's nobody in school that teaches the child to be a good person kind of thing. And like in the sense of, the holistic approach is not valued. as much, I think, in the school settings. It's more learned because the teachers they have their own rating, right? They have to have a certain score that the kids have to get, or their class has to get, otherwise the teacher's salary is cut. So they have to have all these kids passing it's not even FCAT now, it's called something different in Florida anyway. They have a certain exam that the kids have to take, and if they don't have many getting that score, the teachers actually don't get the money. So there's the incentive for the teacher to make sure that these kids do well, and all important is just to get them to do well in the exams rather than teaching them all these other skills that they could learn. So that's hard. We have to make sure the kids are good first, right?
There should be given some annual awards for the disciplined kids in the school. Automatically, the other kids would learn.
Are they given annual awards for discipline? There's usually annual awards are all for academics. I think when they're little,
No,
maybe
now
they get
I
awards.
I see a lot of different things coming up. Like kindness also is one of the things. Like my kids went to 3 different schools in elementary because we lived different places, and they had mindfulness every day in the class, beginning of the class.
Brilliant.
And so I see like these practices are happening, and the education system that we grew up in India, it was solely academic. But here I see a lot of difference, not just academics, art, sports, and they also do community services, and they learn through different projects that give them sense of working together with other kids, how they can adjust, because every kid is different, and that when you are grouped together, you need to behave in a certain way so that you can accommodate other kids and do something. So I see these changes coming up, and these are very positive to see overall.
Good. Yeah, no, you're right. I mean, I definitely think that when they're younger, there is a lot of that, teaching them the values and things like that. And they do get awards for, or they get stickers or prizes for being responsible or for being kind.
But I think these are more for the elementary school than the higher,
when they're younger, exactly. But then as it goes higher, then it becomes very much about gains
competition,
and
competitive.
Yes.
True.
Yeah. And then it's not about the other things. So it's good to have those things, set values in when you're younger. Yeah.
Thank you, Dr. Naina.
Oh, you're welcome,
for
Samriji. Thank you.
For good discussion. And now I think should we do meditation, or we will get good time tomorrow, I think.
I think it's late now, Samriji.
Yes, that's right.
Let's have a good meditation tomorrow.
Yes.
Who is? Oh, Ambandami, Samriji, I think you're giving the talk tomorrow.
Yeah, I can give.
Yes. So we can because Devendra, we will be on the plane. So, and then Devendra will give his research talk on Thursday. And actually, I completely forgot that there's a whole research. So he will talk about a lot of the research that we did on ADHD. So, Samriji, if you can give the talk tomorrow. I think I forgot to tell you. Sorry.
No. Sorry, Dr. Devendra might have sent some such information. So
good.
I knew. Okay, so
and then Anita can do the meditation after that tomorrow.
Yes. Today it is enough.
Yes. Okay. Thank you.
Thank you very much.
Okay. Vandami. Thank you, everyone. Thank you.
Thank you,
Samriji.
Samriji.
Nandami Namaste, Samriji.
Thank you, Narendra.